Hello, and welcome to New England Urgent Care Health Talks. On today's episode, we're going to be changing up a little bit and talking about a very unique topic in the healthcare field. Now, an ever-increasing amount of information on non-traditional, non-Western, or also known as complementary medicine has been entering into our mainstream media. But with that being said, a lot of the basic information just isn't getting out to our public. So that is why today on NEUC Talks, we are going to be talking about what really is complementary medicine. Joining with me, I have Dr. Michael Gutman, our normal guest, Medical Director of New England Urgent Care, and my second guest is Yahel Gutman, Clinical Director of New England Urgent Care, Registered Nurse, and Certified Reiki Practitioner. Welcome, both of you, and thank you.
Hi.
Morning.
Good to be here again.
Now, to start everything out, we're actually going to talk a little bit about Dr. Gutman's credentials as well as Yahel's. So, Dr. Gutman, why don't you start off by telling a little bit about yourself?
I don't want to bore the audience with a repeat performance of our previous shows, but just for the newer viewers, just want to introduce myself. I'm Michael Gutman. I'm a physician. I've been practicing now for 25 years. My specialty is in emergency medicine, and I completed an MD, PhD in the University of Western Ontario in London, Canada. My PhD, incidentally, was in physiology with a specific interest in neurocontrol of cardiovascular function. I started training as a neurosurgeon, but after 3 years decided to switch to emergency medicine, where I took another 3.5 years of training before I became sufficiently qualified to achieve specialty status in Canada, and where I was being trained, and in the USA, where I eventually immigrated to in 1995. I've worked as an emergency physician at St. Francis Hospital full-time until 2012, with the exception of about a 2-year stint from 1999 to 2001 in Bristol Hospital. During that time, I also joined the U.S. Army and after 9/11 and was deployed 3 times between 2003 and 2008 to combat zones, primarily in Iraq. I continue to work per diem at St. Francis, but devote most of my energies and time to New England Urgent Care, which is the business my wife and business partner Yahel Gutman started in 2011. We now run 3 urgent care centers located in West Hartford, Enfield, and Simsbury.
Great. Yahel?
So I've been a registered nurse for 28 years, and my degree was awarded from the University of Jerusalem in Israel. Then I started my way being a nurse in the army, which was fascinating. Then that one led to being an ICU nurse for a few years. Then I taught in nursing school. And after a few years, I decided to take time out and just go and explore other places in the world. And I ended up traveling, actually, for more than a year. And most of that was in the Far East. And that was the first time that I was introduced and exposed to different type of lifestyle, nutrition. I started to learn yoga, meditation, different type of massages. So there I realized that there are other ways than not only nursing in a traditional way can be helpful. That was the first time. I came back from my traveling and I continued doing some risk management. And the larger part of my career, actually, I was the assistant nurse manager in the huge emergency department where we saw about 100,000 patients a year.
Wow.
I loved it. There I had my specialty in trauma nursing and some advanced life support that we used to teach. And the last part, before I immigrated to the United States, I was the nurse manager in a bone marrow transplantation unit.
Wow.
Where we, again, huge hospital, about 6,000 beds, and that was kind of a connection between trauma nursing, fast-paced, and sometimes end of life, and deep into diseases and dealing with that. When I immigrated to United States, I almost immediately joined the emergency nursing team in San Francisco Hospital. And then we ended up opening the urgent cares.
It should also be noted that only after 2 years working at St. Francis, Yahel was awarded the prestigious Nightingale Award for Outstanding Nurse. So as you can see, both of our guests here today are highly qualified, not only in traditional medicine, but also have extensive background in complementary medicine. So today, again, our topic is complementary medicine. Now, Dr. Gutman and Yahel, there seems to be several related terms when people talk about complementary medicine, those including integrative and alternative medicine as a means to good health. Now, could each of you maybe explain a little bit more what these terms mean?
Okay, let's start with defining good health. Most simply, that can be defined as being a state without disease. But being healthy is more than just that.
So, by definition, being healthy is a lack of disease, or when you have a disease, it is lack of ease. What we want to happen, we want our body, mind, and soul to be at ease, which we call it well-being. It's a state of well-being, feeling good. But it's not only in our physical body. We have our physical body, our mind, and our soul. So when all those are connected and balanced, then we are healthy.
Alternative medicine involves non-mainstream or non-conventional healing approaches that are meant to take the place of usual Western medical approach. An example would be taking raw eggplant or dry olive tree leaves only instead of prescribed antihypertensive medications to control high blood pressure.
Okay, so now how is that different then from complementary medicine?
Complementary medicine, it's a holistic approach, but it's a group of healing arts that at the end they lead to balance our energy centers. And when that happens, our body, our organs, all our systems in our body and mind, they just function better.
Though this concept seems to be an exotic Eastern medicine one, the fact is that it's very similar to Western understanding of physiology and body function. As biological organisms, we humans exchange and transform energy. The ultimate source of energy in our solar system is the sun, which is transformed by plant life to food and oxygen. We humans ingest this food and transform the energy to a means of fueling our organ systems. The organ systems must be in a state of balance to function properly, which in Western physiology is called homeostasis.
So looking at it from the complementary point of view, we live in a society, we work, we do things, and we constantly exchange energy. And we encounter a lot of negative energy, which is in the form of stress, or what we call it toxins that we eat and digest, toxins that we breathe. And all those stressors, they actually impact our energy fields and centers, and if we don't work them out, if we don't resolve them, they can bring to anxiety and dysfunction of some of our organs or system. As a definition, anxiety is a maladaptive response to stress. When you cannot deal with it, then this is where you develop anxiety.
So now is complementary medicine then meant to replace Western or conventional medicine that here in the United States we're so used to having?
No, it does not attempt to completely replace Western medical approach. On the contrary, as the name implies, it's intended to complement it. Coming from the medical field, we both believe in integrating both approaches to achieve health. For instance, a massage would be an inappropriate, dangerous way of treating abdominal pain as an initial approach. Making sure someone is not having a heart attack trumps getting Reiki when a person presents with chest pain. However, once the physical manifestations of disease have been attended to, it's important to get to the root causes of how this bodily dysfunction came to be. And that's when complementary medicine comes in.
Okay.
So once we address the cause and we know why this is happening, and again, conventional system is involved, then we can address. Then complementary medicine can actually come in and bring the additional methods that we can add into it to alleviate the disease. First of all, what we want to do, we want to alleviate disease and prevent. It's a lot of prevention, prevent deterioration or happening again or whatever. And what we do is actually we teach the recipients to harness their own body's healing power. So if we take an example, a lot of people that have hypertension or diabetes, the source is anxiety, bad eating habits, overweight, the type of food that they choose to eat, or their entire lifestyle. Mm-hmm. So they would go to their primary doctor, they would be on medication or insulin or whatever. But if we add the component of healthier, better nutrition, if they lose weight, if they learn how to meditate, how to take themselves to a better state of being.
Which are all complementary styles.
And they will remain more relaxed. All that will lead at some point that their blood pressure would come down, their sugar levels would be more stable, then it will end that their caregiver will either reduce the dosage of medication or even sometimes take them off.
That's incredible. So now, what are some further examples of complementary medicine therapies?
Complementary medicine includes a large array of therapies, which can include, this is not a comprehensive list, acupuncture, massage, Reiki, guided imagery, crystal healing arts, and Eastern medicine nutritional approaches.
So now I'm sure our audience is wondering what all these mean. So if we could maybe describe some of these, especially the ones that are a little bit more popular.
Okay, so acupuncture, it's actually a very, very ancient Chinese healing art, which involves penetration of the skin with needles. Of course, there are special needles. Don't try it at home. And they stimulate specific points that they would balance the flow of energy through these energy channels that they call the meridians. It works. There are a lot of studies that show that it works. I personally used it about 16 years ago, and it worked for me 100%. And whatever I wanted to give away, it's gone. Yeah. So loved it, and I think it was great.
Massage is pretty well known. It's a manual, hands-on treatment in which therapists physically manipulate tissues and muscles of the body using various rubbing and kneading techniques. There are over 100 different types of massage techniques, including Swedish, aromatherapy, shiatsu, deep tissue, sports, and hot stones, to name a few. Each style will target specific areas to achieve a different goal or effect. Therapists' movements can help heal damaged muscles, stimulate circulation, clear waste products, boost immune system activity, reduce tension, and or instill calmness.
Okay, one of our favorites is actually guided imagery. Guided imagery, it's used by many practitioners, doctors, psychologists, psychiatrists, nurses.
And coaches for sports, yeah.
Everybody. It is not limited to physical health. It can be used by any emotional needs, any self-image, or any goals that we have, career goals, relationship, anything that we want to work on. By the way, if we look around us, you will realize that children use it naturally, because when they don't want to be in a certain situation, if anything happens that they don't want to deal with, they just go play, they take their toys and they take themselves to a different place where
that's whole good children now. Having their own wild imagination. That's actually very useful.
They know it, but we had to go back and realize that it's there. So The human brain, it's actually a very sophisticated computer. We don't know everything about it, but one thing we know is that we can change the programming sometimes. So our old habits, our thinking patterns, some images that we have about ourselves or others, it's just old programs that we keep in our mind because they were given to us at some point, and we can change them. Once we change the program, the outcome, the movie that we're going to see, it's going to look totally different. So what we do in guided imagery, we just lead the recipient through certain colors and images or structures, and they go in their imagination to a very safe place where there is positive images around, and they can very easily visualize what they want to happen. And once you repeat that a few times, they can learn how to do it by themselves. Then the changes come, and the outcomes are amazing. I've used it myself, used it with my family, and many times integrated it when I was taking care of my patients. Patient with difficulty breathing, pain, they do receive the medication. It does work, but it doesn't always work. And somebody who cannot get enough oxygen, they get very anxious. So I would use it for just a few minutes, and many times the doctors turn around and say, wow, that worked really fast, you know. But
you're integrating both, yeah.
The results are absolutely amazing.
I'm a personal recipient of her guided imagery, and it does work, for sure. Yahel is a very, very skilled practitioner. Reiki is described by adherents as holistic therapy, which brings about healing on physical and mental, emotional, and spiritual levels. The belief is that the energy will flow through the practitioner's hands, wherever the hands are placed on, or held near a potential recipient. Some teachings stress the importance of the practitioner's intention or presence in this process, while others claim that the energy is drawn by the recipient's injury to activate or enhance natural healing processes. The fact is that I've come to believe myself that all of us as practitioners, we're vessels, we're just conduits from a higher power to the people here on earth to heal them, and sometimes it's regardless of our training, we have natural talents to transmit that energy, that healing energy. So further to this notion, the belief is that the energy is intelligent, meaning that the Reiki knows where to heal, even if a practitioner's hands are not present on the specific area. Reiki, as with several other complementary modalities mentioned, is effective when combined with other therapies.
Yeah, the same as guided imagery, actually. You know, you can combine it with massage, you can combine Reiki with massage or crystal healing.
It's not just a solo, it's the act, again, going back to complementary, using multiple elements to find that self-healing.
Yeah.
Correct.
Now, you had mentioned crystal therapy. Yahel, could you talk a little bit more about that?
Okay, that's my other favorite, you know, because they're crystals, again, they're everywhere. We've been using them always. They've been there.
Since the beginning of time.
Exactly. So crystal healing, it's a very gentle, non-invasive approach that actually is meant to harmonize our mind, body, and emotions or emotional state. We want to bring more well-being and take out or release negative energy. So each crystal, they have different colors and vibration, which gives them different healing properties. And as we have what we call chakras or energy centers or whatever we name them, those centers are sensitive to different colors, so different centers to different colors.
They kind of go together.
And by laying the appropriate crystals on those centers, we balance them, we balance their energy, we bring more light in, and the organs that related to that center, to that area, also can very benefit from that. And it just brings us, it's a very, very unique approach that brings us to a state of being in a better mood, better health, and just feeling
Overall better.
overall much better.
Nice. Now, you've mentioned a couple of the different healing therapies. How does nutrition play a role into this?
Extremely important. Eastern nutritional approach is also known as the whole foods diet. The widely held belief stipulates that food should be broken down into nutrients, but instead consumed in their natural state. This coincides with the notion that nature provides the best nutrition and the most balanced diet, eliminating the need for vitamins, mineral supplements, so popular in our culture. So a whole foods diet helps ensure that their entire body gets the required nutrition it needs. That's because whole foods carry out the major function of good diet, which includes absorption, assimilation, and elimination. Everything a healthy body needs. In contrast, synthetic, processed, and refined foods may in fact interfere with your body's normal function, which in time, unnatural foods may lead to the body being more vulnerable to disease. It also incorporates mindfulness about what you eat.
What you're putting into your body.
It's not necessarily a specific food. You don't have to eat granola and Brussels sprouts all the time, but you have to be mindful about what it is that you put in your mouth,
Exactly.
and also mindful of how you acquire the food and even the taste of the food. One thing that I've learned recently about it is that you just have to slow down and chew your food. So many of us just gobble down our food and are completely. It's like passing all those exits on the highway to get to work. You don't even. You're not
pay
even conscious.
attention.
You're not even
Exactly.
conscious of it. And when you're conscious about what you eat and what you put in your mouth and how it tastes, your whole life and your whole body is going to change, and you're going to become much more healthier.
It seems like instead of just eating, you're creating a relationship with food and kind of knowing, not as a person, but you're figuring out, what are the positives and what are the negatives, and
A healthy
building something.
relationship.
A healthy relationship
Yes.
with food,
And
exactly.
it's also making choice. The choice to choose to be healthy, to choose what I'm intaking in my body.
It's a lifestyle. You're
I
choosing.
have the choice.
Exactly.
Rather than it just happens to me.
Yeah. So what are these common threads then between these different types of therapy approaches and lifestyle changes?
So the key is balance and well-being. Now we have to remember, when we talk about balance, we have to remember we can't also be super happy all the time. If somebody is high all the time, super happy, but as just by nature, it's also a lack of balance. What we want to approach is to be content. When we feel good, we function. And again, it goes back to a very, very basic natural things that the nature has offered us forever. And I actually wanted to mention again the nutrition thing, that they just say, eat the food that your grandmother would recognize. If you can't recognize it, if it's packaged and processed so badly, then it's not natural. The same, this is what we want to be, or what we want to use with our
Health and healing.
Yes.
Have it be authentic,
Yeah.
have it be natural. Now, how do traditional physicians and doctors then generally view alternative medicines? Both of you do have an extensive Western trained background. How does the general rest of the medical world view this?
Well, for many years, complementary, integrative, and alternative medicine was considered a fringe, non-mainstream healthcare modality. Nowadays, this seems to be changing, though, with many major hospital systems. I was just reading about Cornell's major hospital system that has it, incorporating integrative medicine into their practice. An increasing number of well-respected allopathic physicians and surgeons, such as Andrew Wiles, a Harvard-trained physician, and Bernie Siegel, a Yale University surgeon, both of who have had published extensively on the subject of complementary and integrative medicine, have not only accepted the approach, but are becoming champions of how we should treat our patients in a more holistic and spiritual manner.
All right. Well, we're almost running out of time. And again, this was just an introduction to what complementary medicine is. We have many more sessions that if you would like to tune in the future, that we will be talking more about these different therapies that are offered. Now, Yahel and Dr. Gutman, where can someone go, one, if they would like to receive such a treatment, or two, if they'd like to receive more information on what complementary alternative medicine is?
Complementary medicine describes a wide variety of therapies, and there's many resources available as a result. Certainly the way Yahel and I have described it, with a unique integration between Western and Eastern medical approaches, it's available at New England Complementary Medicine, which is co-located, incidentally, with New England Urgent Care here in Simsbury at 30 Dorset Crossing. It's on Hop Meadow Drive, just north of the hockey rink. It should be mentioned, by the way, that if you come to the urgent care center, you're going to be treated for your urgent care needs. And if you want to delve into the complementary medicine aspect of our service line, you would have to specifically ask for an appointment, and we do a intake and evaluate and see if the audience member would like to proceed.
It's your choice, basically.
It's your choice. We're not going to start treating your sore throats with crystals and doing all kinds of things that people might not be comfortable with until they feel educated about it. But nevertheless,
maybe the age.
and then it would be in any age. Anybody could benefit from this. You don't have to be ill from it. In fact, quite the contrary. It's better to come when you're well to prevent being ill.
Exactly.
It has to be modified to their age and their medical needs.
Yeah.
So you can contact us at 860-714-9020. And we also have a website, necomplementarymedicine.com, and you can see some more information on there and contact information.
Great. Well, thank you both, Dr. Gutman and Yahel. This has been a very eye-opening discussion, and I hope that all of you viewers out there have become a little bit more knowledgeable on what complementary medicine is and not be so afraid to not only do Western medicine. Thank you again. I'm Alex Almeida. This is Dr. Gutman and Yahel. Tune in next time to New England Urgent Care Health Talks.
Funding for Simsbury Community Television is provided in part by contributions from viewers like you. Thank you.